Start. Hello, Remika. We can start now. It's live. Hello, Remika. We can't hear you. Hello, Remika. Hello, Remika. Can you hear me? There is some technical issue, I guess. I'll just resolve it.
Hello and good afternoon, everyone. This is Rimika, and on behalf of ForOptom team, I would like to welcome you all. Starting with short intro of our program, which has been conducted by ForOptom team, where we discuss and interact about optometry-related topics. Today, we have Mrs. Archana Murthy, who is going to talk about new look to face the future. Before starting the session, I would like to introduce Mrs. Archana Murthy among all. She is an engineer by qualification and an ocularist by profession. She has also completed her diploma in hospital administration and is trained ocularist. She is Karnataka's first trained ocularist and been practicing this art since 2003. She has given new face to more than 2,500 patients, including children who have lost their eyes due to accidents, eye disease, and eye cancer. She has won several Best Paper awards in ophthalmic conferences. She is on the mission of bringing awareness about ocularistry and facilities available. She will be discussing about the art of ocularistry and boosting confidence of patients who has lost their eye. So, on behalf of ForOptom, I would like to welcome you, ma'am. Over to you, ma'am.
Thank you, Rimika. Thank you so much for your warm introduction, and good afternoon, everyone. I hope I am audible to each of you. Am I audible?
Yes, ma'am.
Yes.
Yeah. So good afternoon. I'm sure each one of you must have had good lunch. I hope you are up and fine, not going to doze off. Okay, let's make it interesting. And ocularistry is one such field which brings life in one person. So let's see what difference we ocularists can make for this society. At the outset, I would like to thank ForOptom for giving me this opportunity to be part of their continuous education program, which is happening on the digital platform because of this lockdown and COVID crisis. I hope we all stay safe and get over this crisis as soon as possible. And wishing you all good luck. Let me start my presentation. New look to face the future. Rimika has given a very warm introduction about myself. I'm Archana. I have done my engineering in electrical and electronics, and I work through Prabhai Clinic and Vitala Eye Hospital. And these are the two institutes which has been there for last 80 years and which has been run for last by 4 generations. Well, loss, absence, or disfigurement of an eye is a cosmetic blemish which not only leads to loss of function of an organ, but causes emotional problems in the patient as well as in the observer who looks at the patient. Well, this is a quite traumatic situation for any patient because eyes is the index. You know, anybody who looks at you, first they see your eyes. And it's quite disturbing when a patient stares at you or makes a remark on your disfigurement. And there could be various reasons. You know, a person can lose an eye because of injury or a trauma. And many a times there might be congenital anomalies where the children are born with various diseases, and patients can have variety of eye diseases which could be due to retinal problem, glaucoma, uvea, cornea. So I mean, you know, a person can lose an eye because of various factors. And many a times a patient can lose an eye because of eye cancer also. And there are situations where eye can get disfigured because of the chemical or the acid burn. So what does wearing of a shell do? See, wearing of a shell not only enhances the outlook, but builds the confidence in a person. So it is very important for us to give a new look, for us to look normal for the society, because all these one-eyed people are still normal. They can do all possible work which a bilateral normal person, seeing person can do. So it's very important for us to give a normal look to these patients. Let us slightly go back to the history of artificial eye. See, it's been there from 2900 to 2800 BC, where it was started much earlier with the gold. It was layered by gold. Later, further, it was developed in Egypt, and Roman priests were doing it. And in 17th century, Venetian glass blowers were making these glass eyes. However, these were breakable. You know, once it would be dropped, it would break, and you know, the durability was not there. In 19th century, Germany refined it in a much better way, and in 20th century, a new material called polymethyl methacrylate was used. What is this polymethyl methacrylate? It's a high grade density plastic which is widely being used because of its density, longevity, because it lasts long, and moldability. It can take a shape of whatever mold we give, and this is very well accepted by the body. It doesn't have any side effects. So it is very medically tested, and it is highly being used. Here, another thing I would want to stress, because still in spite of so much development, we still have people dispensing stock eyes. Here I want to highlight the disadvantages of the stock eye and the advantages of customized, because people should be aware of what are the negative things if they use a stock eye. Here patient will encounter discharge problems. Why will the patient get a discharge? Because the back surface is not matched in a stock eye. The stock eye, if you see, it's a hollow back surface where the dust particle can accumulate, leading to discharge. And discharge is the first step to start it gives rise to the socket damage. Because these stock eyes are made in bulk, not all, say sometimes you do get matching, iris color matching with stock eye, but it's not perfectly matched with the natural eye. And as I mentioned before, here, because of the hollow back surface, patient will have very limited movements. And here patients will have to remove it probably every night, or very frequently. And because of the continuous use of the stock eye and the weight of the stock eye, over the course of time, there will be a lower lid sag, which will damage the socket, and it makes the it makes the shell not to sit in the socket. And because of the use of the stalk eye, the socket gets contracted. So these are the very important disadvantages which any ocularist or an optometrist should be aware of, because dispensing of stalk eye is still being practiced in most of the places. I would like to highlight the advantages of the customized prosthesis. Here, patients will have very minimal discharge. In my coming slides, I will explain why the discharge is very less. Here, the prosthesis is painted in front of the patient, and hence it will be very nearest to the normal eye. Here, back surface is matched with the front surface of the existing socket. Hence, the patients will have more movements. Here, patients need not remove the prosthesis probably till 6 to 8 weeks. And some patients I have seen in my practice, they haven't removed for 3 to 4 months. But well, for hygiene purposes, we do advise them to remove it once in 6 weeks. These customized prosthesis modifications are possible. So what is ocularistry? This is a fantastic field. Trust me, it gives lot of satisfaction with the job which we are doing. This is an art with science where there is lot of creativity. And what is ocularistry? Ocularistry is the art of fitting and fabricating an artificial eye for a particular patient in comparison with the other eye. This shell is termed as customized ocular prosthesis. Well, whenever we see a face which looks as normal as the other eye, it gives lot of confidence either for the patient or for the parents or for the relatives or for an observer. So this is one field which is very important to make a difference in one's life. Many a times these patients are psychologically traumatized, mentally disturbed, and they don't want to even get out of the house. So ocularistry field brings back that confidence in a person by wearing a very similar or in match with the other eye. What is the procedure we follow to fit the prosthesis? See, once the patient comes, his socket is evaluated, okay, and a right size impression tray is taken. This is inserted inside the socket. A toothpaste kind of a material, is injected inside this socket. This will take about 2 to 3 minutes for it to settle. Here you can see the back surface is completely matched with the front surface of the existing eye or the socket. Once this matching is done, this is transferred as a wax model, and an aluminum button is used to fix the plane and position of the iris so that we don't get a squint, and a POP mold is taken. Inside this POP mold, there is a corneal button which is painted by seeing the other eye, and this is inserted inside the POP mold. Here, white PMMA is placed in this mold and pressure cured for about an hour from 0 to 100 degrees in boiling water and taken out. It is then tried on the patient to check for the size and the position. And then once it is tried on the patient, we again change the, chip a layer and we paint the scleral features and the blood vessels, and the fine painting of the iris is done. Once this is done, again another layer of clear is placed over this prosthesis and pressure cured for about an hour, and polishing is done in various steps to give a smooth finish. And then this is tried on a patient. This usually we distribute over 3 days. There are ocularists who do in a day or 2 days time. I prefer to do it on 3 days. The reason being, on the first day, generally the patient is little apprehensive or tensed or worried what is going to happen. So invariably the normal eye color is slightly different than the normal color which usually takes. So I allow the patient to rest, relax for about a day. And on the second day, I do the painting. And on the third day, we deliver the prosthesis to the patient. And again, call for a follow-up after a month. See, the main advantage of customized prosthesis is here it fits the socket completely. In a stock eye, there is a gap which is formed between the socket and the shell. Hence, there is a space where a dust can accumulate, leading to the discharge in a stock eye. This is not there in a customized prosthesis. Here, the customized prosthesis completely fits the socket, where a tear pooling can occur completely, and hence the socket remains healthy, comfortable. And this is another slide which shows you the extent of movements achieved because of a customized prosthesis. See, in customized prosthesis also, there is certain amount of limitations on your extreme movements, but definitely it is any day better than what you get from a stock eye. Another advantage is because you paint in front of a patient, you can give a very nearest color match to the patient and it looks almost normal. See, here is another case where these patients have different eye diseases, and because of which the normal eye color is slightly different from the normal eye. But this any day it is more advisable to give a similar looking prosthesis which has the same color as the other eye, which looks more normal and nice. Sometimes you do get patients who want to have a normal color eye than when compared to the other eye. They say at least one eye I would want it to look nice. So finally we leave up to the patients to decide what color they want. And here in customized eye, there is a major advantage is patient will have a very minimal discharge. We also advise them to use lubricating drops, but still when compared to the stock eye, in customized prosthesis, there is very minimal discharge. Here I would like to emphasize on one thing. It is not a rule that the socket has to be empty or there has to be an implant when there is an eye already inside. I mean to say that not all thusical eye has to be removed before you fit a prosthesis. If the thusical eye is painless, then definitely it doesn't indicate for a removal of an eye. In fact, prosthesis over thusical eye gives better results, more movements, and patients will have the security of having their organ that they still have the eye in their sockets. Though it's a blind eye, people still have the feeling that their eye is still intact. But what are the precautions or the steps which we need to take before fitting a prosthesis on a thusical eye? Because sometimes if it's a painful blind eye, it is not advisable to fit a prosthesis on these painful blind eyes. So we have to take a lot of consideration and checklist before we go ahead to fit prosthesis over a thusical eye. Well, in phthisis bulbi, first we need to check whether it's a shrunken eye or it's of the same size or it's bigger than the normal eye. And in shrunken eye, we can segregate into painless and painful. If it is a painless eye, then we'll have to check whether there is enough space in the socket or if there is less space in the socket. If it's same size, again, you have to check whether the patient is encountering any pain. And well, if it's a bigger than the normal eye, definitely it's not an ideal case to take up for the prosthesis, because cosmetically it is not good and patient is definitely not going to be comfortable. Before going ahead with a prosthesis on a thumbsical eye, it's always advisable to give a trial iris painted shell to see if they can tolerate, because the amount which they are spending on the prosthesis is quite a bit. So it is important to see the comfort of the patient. That has to be the priority. And well, if the patient is comfortable, then you can go ahead. We also need to check on the ciliary tenderness. How do you do it? You apply pressure on the closed lids, see if the patient is comfortable or not, and then take another point. Here, when you give a trial iris painted shell, ask them to make a chart so that, if they have any pain in the morning, afternoon, or evening or night, any burning sensation, just make a tabular column and have a sheet at the end of the month. If the patient has this pain or discomfort for more than 3 times a day, definitely it is not an advisable case for a prosthesis. If it is less than 3 times, please go ahead with the prosthesis. If it's more than 3 times, definitely not advisable to go ahead with the shell. This is one portion. Another portion is post-surgical cases. When do you start a prosthesis? There are times when patients come and they say they are in a hurry, they need to get the prosthesis done because they want to get that new look. But well, please hold on. It is very important for the socket to heal completely, to give a good fitting prosthesis, because this prosthesis will last for about 4 to 5 years without any problems. So even a smallest difference will talk about the quality of work which an ocularist does. So it's important for us to allow the socket to heal completely and then to give the prosthesis. So for post evisceration and enucleation, wait for about 5 to 6 weeks and then start the procedure. With the post graft, it's from 8 to 10 weeks, and sometimes I do wait for even 12 weeks because graft will take time to heal. Deepening of the fornices or torsorrhaphy about 2 to 3 weeks. And well, if there is an infection like redness, inflammation, GPCs, definitely please don't do it at least for 2 weeks and then only go ahead with the prosthesis. What is this is another section where a socket is enucleated, where complete eyeball is removed. And it is also important for us to give a prosthesis in such cases as well. But we should also let the patient know the importance of having an implant inside a socket, because the weight of the shell is reduced if the implant is there. In this case, you can see that an implant has been put in the socket. The advantage of an implant is it covers up the lost volume and the mobility of the artificial eye. The movements are excellent if an implant is given. And over the years, when the patient uses a prosthesis with an implant inside, the weight of the shell is less, and hence the socket remains healthy and the lid sag is minimal. What are the risk factors of implant? Not always we have this, but still the patient should be aware that there might be migration of the implant, leading for an ocularist to, to fit the prosthesis, it may get difficult for a ocularist. And certain times there may be exposure of an implant. It can happen because of various reasons, which I'm going to explain. And with the graft, yes, patient will have to go through multiple surgeries. See, this is another case of implant exposure. Implant exposure can happen because of the surgical techniques which has been followed, or when the body doesn't accept the implant, or when the patient uses an ill-fitted prosthesis which is not polished properly. See, this is the customized polishing where we give a smooth surface. Here you can see the kind of surface which is being given. See, this is still being claimed as customized prosthesis. Well, let me stress on the point that polishing is, excuse me, polishing is very important for the maintenance of the socket. So it is very important for us to give a smooth surface. Another thing, important thing which I would like to stress is whenever post surgery, it is very important to give a right size conformer in the socket till the prosthesis is being fitted. In fact, please make sure that you provide or your surgeon has the conformers with them which can be used just after the surgery, so that the socket healing can happen completely and neatly. I take this opportunity to thank all our surgeons, because without surgeons, we ocularists cannot give a fantastic looking prosthesis. Here is one case which came with a chemical injury, and I actually had to give up on this case because I initially told my patient that it's very difficult for me. But he was lucky enough to be under a great surgeon who operated him for about 5 times, and at the end of 6 months he could get this kind of a result. So the patient also should be patient enough to go through these procedures, but definitely he'll get good results. And you need to have your surgeon support to give a good result in the socket. And many a times it is assumed that prosthesis can be fitted when a child attains 15 years or 18 years, or let the child grow up and things like that. I would like to stress on this point that it is ideal, appropriate, and it is really important for us to start the fitting of the prosthesis as early as possible in children. It can be as early as a month old, because the prosthesis fitting, once it is done as early, it facilitates the orbital growth, giving a neat facial symmetry without any contracture. So it is very important for us to fit the prosthesis as early as possible. And also, how can you give a good prosthesis? See, it just doesn't happen with a good ocularist hand. There are variety of reasons which play an important role for a good looking prosthesis to be given. First and foremost is the socket condition. There should be enough space in the socket. There should be good depth in the fornices. Implants should be centrally placed, and lids have to be very healthy. And of course, facial symmetry is also equally important. Well, contracted sockets are a nightmare to handle. What are contracted sockets? These are sockets where the lids are, upper lids are contracted and where orbital tissues have shrunken and there isn't enough space in the fornices to hold the shell, and various reasons lead to the contraction of the socket. It can happen because of chemical injuries, poor fitting uh, uh, prosthesis, and ill-fitting prosthesis without an implant. Lot of reasons can lead to contracture of socket, and in these cases it is definitely very difficult to fit a prosthesis, but with lot of effort and modifications, yes, we definitely can give good results. Though we cannot get fantastic results, it is definitely any day better than giving with a stock eye. In these contracted sockets, there will be certain amount of dryness which can happen because of incomplete closure of lids. So we have to advise for lubricating drops. Yes, we are not got to make 100% same prosthesis matching the other eye. So we do give glasses. One is to cover up the small differences. Second one is to protect the other eye. So it's important for them to use a polycarbonate glasses with a shell frame post fitting of the prosthesis. Yes, girls have an advantage. We do advise them to go in for makeup, eyeshadow, eyeliner, mascara, etc., which can enhance their look. This is the advantage of a customized prosthesis. See, in the first picture, you can see this patient. He's come from Yemen, who has had a bullet injury, and he's been using stock eye. There's a lot of discharge, and we did customized prosthesis, and this was the final result. And he was very comfortable and happy. As I told you, there is lot of creativity in this ocularistry. We do make even lids, which mimics the normal lid, and it looks fantastic. This was another case from Yemen, who was a soldier, and he had a bomb blast. And in his case, we did lid construction also, and we gave him artificial lashes, which looked fantastic. Well, as I said, in enucleated case, when there is no implant and when patient refuses to get the secondary ball implant, if you give the same size, or the big size prosthesis, because of the weight of the shell, the lower lid gets damaged. Hence, we do make hollow prosthesis where weight of the shell gets reduced, and this can be inserted in the socket, and this does give good results. We also do spectacle mounted prosthesis where there is no space for us to fit the ocular prosthesis, and when there is a severe contracture, we give them spectacle mounted. And this is another case who had a carcinoma, and we did prosthesis on a spectacle mounted prosthesis. Let us come to the maintenance of the prosthesis. Here, cleaning has to be done once in 4 to 5 weeks. They don't need really very hi-fi solutions or anything, but very clean water and ordinary soap. But well, I insist again here that they should not use any moisturizing soap because it leads to a lot of discharge formation. Polishing has to be done twice a year to get rid of the scratches and the protein deposits. When do you have to replace the prosthesis? Whenever, see, many of the patients still have the feeling that these prostheses are permanent. Well, it is important that for any patient, there are a lot of physiological changes which happens over the course of time because of his age and so many things. So the prosthesis will have to be replaced as and when there is a variation of the socket. processes will start looking small, it tends to fall, or when it starts rotating, it means to say that the back surface doesn't match, or there is variation in the socket, and or if there is lot of discharge, it means to say that there is some difference changes which has happened in the socket. So that is the indication for us to change the prosthesis. So to conclude, I would say that prosthesis fitting has to be done with a teamwork. You will definitely need your surgeon support or your ophthalmologist, without which it is very difficult for you to give a fantastic result. And ocularistry is just not about fitting of prosthesis, but it also involves bringing the confidence in a patient. It is important for us to understand that prosthesis has to be replaced as and when changes happen. Thank you. I would be happy to take any questions.
It was an interesting and wonderful session, ma'am.
Thank you, Rima.
We are not getting questions yet, so I think we
No,
should wait for a few minutes.
Sure. Yeah.
Until then, I request you to share your experience on today's session.
Oh, this has been very lovely. I must tell that Mr. Janak was a person who, invited, and Satyam was another person. I would really like to thank them, and Remika, thank you for hosting such a wonderful event. And it's been so smooth and nice. And in this lockdown, I think this was a wonderful platform to share the knowledge uh, all over the place. And it's important for us to realize the importance of ocularistry, because see, even in the lockdown, I have had many cases who called up and said, we need to get the processes. But when I told them, is it really required now at this point of time? But you know what they said? Madam, this may not sound emergency for you, but for us, it is important. We can't even step out of the house without processes. So that only shows that how important this field is to bring a new look, to be normal in this society. It is quite important for us to be normal to the people and not show our weakness, because a one-eyed patient can still do any work like how a normal person does. This is what, in fact, I tell even parents of kids who come, who are mentally disturbed and who are feeling low seeing the condition of their child. So this is one field which each one of us should know, and especially optometrists, because the first point of contact for any patient is an optometrist. So I think each one of you, it is important to know the inner details of the ocularistry field, because this is one field which gives lot of satisfaction.
So, ma'am, we are getting few questions now.
Yeah, please.
Mr. Ananta Paudel is asking, what are the options for accentration?
Accentration, see, you can have a spectacle mounted prosthesis, orbital prosthesis, like silicone prosthesis. What happens is, it depends on the affordability of the patient. With a spectacle mounted prosthesis, yes, it is one-time investment, and it doesn't require any maintenance. But if it is a silicone based prosthesis, then patient will have to replace it probably every once in 3-4 years, because silicone develops porosity. And yeah, these two are the things where you have an option for accentration.
Thank you for the answer, ma'am. And thank you for your question, Dr. Chandrasekhar Chauhan. He's asking, how can one become an ocularist?
Okay. Is it Dr. Chandrasekhar Chauhan?
Yes, ma'am.
First thing, I would like to convey my respects to sir, because Dr. Chandrasekhar sir, who is treated as father of ocularistry in India. He is my mentor, and whatever I am today is because of him. And with his teaching and guidance and inspiration, I have got into this field. So thank you so much for this thing. Who can become an ocularist? Any science graduate, and now it is particular that an optometrist can or will be one of the criteria to become an ocularist. Anybody who has passion for painting, has lot of patience, and who has time, and who has love for creativity, can get into this field of ocularistry.
Thank you, ma'am, for the answer. So we end the discussion session here, and that was a lovely session having you, ma'am.
Thank
And
you.
on behalf of IBIT ForOptom, I'd like to thank you for sharing your knowledge and valuable time with us.
Thank you, Rimika. Thank you so much.
And I would like to thank audience too for being supportive and being with us till the end of the session. Now I would like to end the session here, and for further updates, stay tuned with us. Thank you.
Okay. We are not